And then in the United States, in 2017, there were over 73,000 amputations performed on patients that had diabetes. And again, this was not related to any type of trauma in the lower limb. This was 100% as a result of diabetes. Hey everyone, thanks for tuning in. Steven here with Team Euphoric, and today I'm going to be talking to you about diabetes, obesity, and amputations. This is something that doesn't really get discussed too often, and it's something that's really important, and the prevalence of amputations related to obesity and diabetes is something that a lot of people, I don't think they realize how prevalent it is. Now, the numbers that I'm going to be listing for you, they're outdated, and the prevalence of diabetes has increased significantly since these numbers have been released. So the amputations are actually much higher than the numbers I'm going to be giving you. But in Canada, where I live, in 2011 and 2012, there were over 2,000 amputations performed, and this is lower limb amputations, and they are due to specifically diabetes. It had nothing to do with lower limb trauma. There were over 2,000 amputations in 1 year in Canada. Then if we were to look at the UK, specifically in England, there were over 8,000 amputations performed in 2017, and this was directly attributed to diabetes, nothing to do with lower limb trauma. And then in the United States, in 2017, there were over 73,000 amputations performed on patients that had diabetes. And again, this was not related to any type of trauma in the lower limb. This was 100% as a result of diabetes. And I ended up going online, I ended up finding a few articles, and I wanted to read one of the articles with you that discuss the prevalence of amputations in the UK. This one article right over here, it comes from The Sun, and this one over here, it's specifically The Sun in the UK, and the title is called Fatties Get the Chop. Now, before I even get into the article, I just want to say this is a pretty tasteless title for an article. I understand why they did it, though. It's The Sun, and this is the kind of stuff that they do. I remember back in 1997 when Princess Diana died, we also have The Sun here in Canada, and they had an article, and it was called Die Dead. But anyway, let's get on with the article. It's called Fatties Get the Chop. Obesity leads to 23 amputations every day as 25,500 toes, feet, and legs are removed from diabetic patients in 3 years. Experts say the vast majority of cases are preventable with better diet. And the article was written by Nick McDermott, and it was published on the 28th of September in 2017. Let's get into the article. It says, surgeons are carrying out a record 23 amputations a day due to the UK's obesity epidemic. More than 25,500 toes, feet, and legs were removed from patients suffering from diabetes in England from 2013 to 2016. It is a 16% rise on the previous 3-year period when there were 22,000 such amputations. Experts say the vast majority of cases are preventable with better diet and better weight loss. And stay ahead to the end of the video, because at the end of the video I'm actually going to be giving you some tips on how exactly to improve your health and how to lose weight if that is something that you are interested in doing. And it's going to be really simple things that you can incorporate. It's not going to be anything complicated, and it's pretty much the same principles that I apply in my coaching practice. But anyway, let's get on. More than 4 million Brits now have diabetes, up by 2/3 in a decade, and around 90% of these cases are type 2, caused by obesity. Now, type 2 diabetes, that means these are specifically preventable with proper diet and lifestyle. So these are people that do not need to get these like amputations if they incorporate proper diet and lifestyle habits. Now, having diabetes increases the risk of the serious complications which can lead to amputations such as nerve damage, ulcers, and poor circulation. 4 out of 5 patients die within 5 years of losing a limb. I'm going to repeat that. 4 out of 5 patients who get an amputation as a result of diabetes are going to die within 5 years. So if you are somebody who has diabetes and you've gotten to that point where you've had to get an amputation, there is an 80% chance that you are going to die within the next 5 years. Think about that the next time you get triggered by somebody talking about losing weight or eating healthier, because if you want to prevent death, prevent amputations, all that type of stuff, these are things that can be easily preventable. All you need to do is just make a little couple changes here and there to your lifestyle. You don't need to do a drastic change. You don't need to become a fitness model. All you need to do is just make a couple of healthier lifestyle choices, which I will get into at the end of the video. Now, Diabetes UK, which compiled the report, is calling for greater awareness of foot health, with research showing 2 in 3 adults are unaware ulcers can lead to amputations. The charity's Dan Haworth said that the loss of a limb can devastate lives. He said people should regularly check their feet for danger signs, which include calluses, changes in shape or color of skin that feels cold to the touch. Tam Fry of the National Obesity Forum said, successive governments have done nothing to reduce levels of obesity in the UK, and we are now seeing the tragic consequences. Professor Jonathan Valabji, NHS England's National Clinical Director of Obesity and Diabetes said, "Only this month, Public Health England published a report which makes clear, thanks to improved NHS care, the risk for any individual with diabetes suffering a major amputation has actually fallen significantly. Nearly 2.5 million adults and children diagnosed with diabetes will also benefit from around 42 million of additional national funding, some of which will go towards advancing care and treatment and improving access to multidisciplinary foot care teams in 50 parts of the country." And that's pretty much it for the article. Now, in terms of this actual article and just this topic in general, it's going to be very, very important. If you are somebody that has either diabetes or if you are on your way to developing diabetes, these are things that can be easily preventable because type 2 diabetes is a direct result of diet and lifestyle. If you have type 1 diabetes, there are basically two types. Type 1 diabetes is the diabetes that is more genetic, and type 2 is the one that you acquire through poor lifestyle habits. Type 2, it used to be referred to as adult onset diabetes, but over the last couple decades, more and more children are being diagnosed with type 2 diabetes, so it's no longer called adult onset diabetes. But type 1, that's the one that requires insulin. Type 2, that is the one where if you just make a couple lifestyle habits, you can actually treat your diabetes and eventually get rid of your type 2 diabetes. Some of the things that you can do, instead of overhauling your entire life, start focusing on just incorporating little healthy habits one at a time. A few of the habits that I'm going to be discussing right now, number one, water consumption. If you just add a little bit more water, this is something that can make a tremendous difference, because if you are adding things like water to your diet, a lot of times people end up replacing things like water with sugary sodas and fruit juices and those types of things. If you eliminate those types of drinks and you replace them for things like either water or something like sparkling water or just something in general that has 0 calories that you are going to be drinking, that is greatly going to reduce the amount of calories that you're consuming throughout the day, and this could have a great impact on the amount of weight that you either gain or lose throughout the course of your life. So if you incorporate more water to replace those sugary drinks, then that's going to be of great benefit to you. Another thing that you could do is making sure that your stress levels are maintained. Your stress levels, when you get stressed, your body secretes the hormone cortisol. Cortisol is your stress hormone, and the thing with your body is your body physiologically cannot differentiate between different types of stress. So whether you are stressed because you have a very, very stressful work life, home life, relationships, anything like that, or whether you are stressed because you ran on the treadmill for 5 hours and you were not capable of handling that type of workout, your body is going to react the exact same way. Physiologically, it's going to secrete cortisol. That is going to raise your body's stress levels. That is also going to make you less insulin sensitive, meaning if you do consume a lot of sugary things, then your body is not going to be able to make use of it as well as it would have had you not had issues with insulin resistance. Another thing with regard to cortisol is as cortisol is elevated, testosterone is going to be suppressed. Testosterone is going to be a hormone that allows you to build muscle and burn fat a lot more easily. So if you have chronically elevated cortisol levels, then your testosterone is going to be suppressed, and also your insulin sensitivity is not going to be as insulin sensitive as you would have had your weight been at a normal level. So these are a few little things that can make a dramatic improvement in your actual health and in your actual weight by incorporating these. So number one, drink more water. Number two, manage your stress levels. Number three, start eating more whole foods. Instead of getting packaged foods, processed foods, or going for fast food, start cooking yourself, start making your own little meals, find out what you like. Another thing with regard to the diet is, when it comes to diet, my number one rule that I have with my patients and my clients is, if you do not like it, do not eat it. A lot of people are going to say you have to eat this way to improve your health, and the truth is you could get healthy on any type of diet as long as your body is responding well to it. So find the foods that you like, find the diet that responds best for your body, and stick with that. If you enjoy the foods that you're eating and your body responds well to it, it's going to be very sustainable for you. The more sustainable it is, the easier it's going to be for you to hold on to that diet for the rest of your life. And you want this to be a lifestyle change. You're not trying to lose weight for a month or two. You want to be able to hold on to this for your entire life. Another habit that you can do is make sure that you're getting an adequate amount of sleep. Adequate amount of sleep, this is going to be very similar to regard to your stress levels. When you are not getting an adequate amount of sleep, your insulin sensitivity is going to decrease, which means it's going to be a lot easier for you to store onto fat. Also, your testosterone is going to be lowered, which means it's going to be harder to build muscle and easier to put on fat. Also, your ghrelin, your hunger hormone, that is going to be elevated as well. So if you don't get a good night's sleep, in the morning, your ghrelin is going to be elevated, and it's going to make it much easier for you to make poor food choices in the morning. And one thing that we know is if you make poor food choices first first thing in the morning, there's a greater likelihood that you are going to make poor food choices throughout the rest of the day. So if you get an adequate amount of sleep, your testosterone levels are going to be normal, your cortisol levels are going to be normal, your insulin sensitivity is going to be normal, you're not going to be secreting high levels of ghrelin first thing in the morning, you're going to be able to make smarter food choices, and that's going to carry out throughout the rest of the day into making better choices as the day progresses. And then a few other things that you can do as well. If you are somebody where you live with other people and they tend to keep unhealthy food in the house, what you can do is just make sure that they are out of sight, out of mind. So if you live with other people and you can't completely get rid of all the food in the house because, again, you live with other people, you're going to have to accommodate them as well, just ask them if they can put the stuff away. If you're living with roommates, can they put their junk food in their room? Can they put it behind the healthy food? That way it's not staring you at the face every single time you go to open up the pantry or the fridge. There are a lot of ways that you can do this where it'll make your life a lot easier. And those are just a few really quick and easy tricks that you can do to make it a lot easier when it comes to losing your weight, managing diabetes, and all these other things. You don't need to make it incredibly difficult. You don't need to overhaul your entire life all in one shot. If you just make one small change every single month, eventually all of those small changes are going to accumulate into very, very big changes. So focus on creating small little habits here and there, just incorporating small healthy habits, and then eventually you are going to find that it gets easier and easier once you get to those bigger habits. But focus on the small ones. Ask yourself, on a scale of 1 to 10, am I 100% positive? Am I at 10 out of 10 that I can accomplish this small habit? If the answer is no, find another habit that is easier for you to do. If you find a habit and you can say to yourself, 10 out of 10, I know 100% I can achieve this, then that is the habit you want to stick with. The more of those habits that you knock out of the way, the easier those bigger challenges are going to be in the future. But if you're already trying to tackle the big habits right in the beginning and you fail and you fall off, the chances that you're going to be able to stick to it later on is going to be very, very slim. So stick to the easy habits that you're able to accomplish, and then once you get those under control, it's going to make managing the bigger habits and the more difficult habits a lot easier because you're going to have that self-confidence that you were able to do it with the other habits earlier on. But that's pretty much it for today's video. If you guys enjoyed the video, be sure to smash that like button so I know to make more of these types of videos in the future. And if you're either new to the channel or haven't subscribed yet, be sure to subscribe to the channel and hit the notification bell, as I will be uploading new videos every single day. That's it for today's video. Thanks for tuning in, and I will see you again tomorrow.